Hello everyone. I'm Dr. Dilip, and today we have Mrs. Jegatheeswari Jegan with us, who has experience of about 17 years in nursing. So she did a lot of teaching as well, and she's been in multiple roles, from clinics to being the staff nurse to being a supervisor to being in charge. She was supervising the ICU unit as well, and she did a lot of teaching and being a nursing instructor. She's very much into teaching and she's very passionate about it, and that is the reason she's here with us today to help us improve the skills of nurses and how to improve nursing training overall. And Mrs. Jagdishwari, we are very pleased to have you here. Please go ahead and start with the topic and also introduce yourself to our audience. Thank you.
Thank you, Dilip. So I'm Jegatheeswari. As Dilip introduced, I have 17 plus years of experience both in clinical setting as supervisor and also in education background. I served in various roles in different institutions, teaching college students and staffs in the hospitals and staffs working in companies. So that's about my background. Thank you for joining us, and let's begin. So today's topic for the webinar is transforming nursing education in India. So first, let's understand why transformation is required. So do we have any gap, or do we need to fill in the gap? So there should be a reason for why we are looking for transformation. So transformation is required to produce highly skilled nurses, tech efficient, because the world is moving towards technology. And it is required that we produce compassionate nurses who are capable to handle healthcare challenges at various levels. Now, how can we do this? Is by integrating technology at various levels in healthcare setting. So, what is the current scenario, or what is the limitation that is prevalent in nursing education, which is hindering us to grow, or which is stopping us to transform the nursing education? So, let's see few causes of or few limitations in nursing education. The first one is shortage of skilled educators. So, moment we complete the degree courses, we think that we have done the course and we need not upskill ourselves. That puts the educators to a stage of stagnant, and world is moving faster. And to keep ourselves with pace, I think the trainers need to upskill themselves. But right now, that is at the lower level. The second reason is insufficient practical exposure. Students get less exposure, as well as faculty members who are training the trainees also get less exposure, which puts the nursing education to a back level. And then lack of advanced technology integration. So therapeutically, we have a lot of technology incorporated for therapeutic purposes, but for training, technologies are evolving, and if we fail to do, or if we fail to accept it, I think it would become a great issue, and we are not in par with what the world is expecting us to do. Overcrowded classrooms, nursing shortage is huge, and so the affiliating bodies or the authorizing bodies are increasing the numbers in classrooms from 60 to 100, 100 to 150, 150 to 200. But does that produce quality nurses who are capable enough to handle patients in future? I think we are lacking in that. And limited focus on specialized training. We do BSc nursing where we touch upon the subjects that are being laid down by the uh, councils, but do we do specialized training when we are exposed to handle patients? For example, do we do emergency course training to handle emergency patients when we are posted in emergency? So I think with the generalized education, we try to cope ourselves with the emergency situation. And if we are going to do that, we are going to lag behind. And urban rural divide. So people who are, or the students who take up course in the urban area, are going to get exposed to a variety of cases, and students who are exposed in rural area are going to exposed to limited cases, and that is going to cause a huge gap in the nursing education. And of course, financial barriers. Most of the students who take up nursing education or who take up nursing as their career uh, suffer financial deficit. So I think all these things contribute towards the limitation or which set us back in the nursing education. Okay, now how are we going to fill this or how are we going to transform nursing education? Let's look at the right approaches which would help us to transform nursing education. The first is learning by doing. So hope all of us know that anything we do, we understand it better and the retention skills are also better. Our cognitive and psychomotor skills are going to be better when we do and learn. And that is something that we have to keep in mind. Everything taught is taught to a cognitive level, and when we do, it is imbibed into a psychomotor level, which students can perform well when they are exposed to the real life scenario. Self-reflect and self-correct. If there is a system which would allow us to practice, reflect, and self-correct, I think that would be a great system which enables the students and faculty members to dwell on. Fun. Learning had to be a fun-based program. It's not just about forcing the theory or making the students learn in an environment where they're not interested. There should be fun in learning, and that needs to be incorporated in the nursing education. Students needs to get exposed to wide range of clinical scenarios and skill training. Only then they would be able to be competent enough or confident enough to handle patients at the bedside. And all of this should come within our budget. That is something which is important. Only then we can think of transforming nursing education. Now, why technology? And in the first slide itself, we saw that technology can fill in the gap or can transform nursing education. Why technology in nursing? It is simply to enhance learning experiences because technology will bring in more fun, more gamification element that would add to their learning experiences. Second is to improve accessibility and inclusivity. So students who are studying in urban and who are studying in the rural area can access if the system is going to be imbibed in technology. So that way, I think we are improving the accessibility for the students who are taking up the course with technology. To promote patient safety, the more they are confident, the more they are going to give care to the patient, the well, they are going to manage the patient well, and they're going to give proper care to the patient, and the safety of the patient is going to be maintained. To have standardized education, so here and there, institutions will have their own protocols, and students study in different institutions, come to work in one healthcare industry, or one healthcare organization is going to suffer standardization of executing whatever they have learned. So if there's a technology which is going to bring in standardization across India, that is going to be a huge impact and which is going to bring transformation in nursing education. Familiarize students with technology. Right now, many students lag behind technology, and I think COVID introduced technology and with which students were able to get oriented to the technology, and some of them are efficient in using it. And the more they are familiarized or the more they know about technology, I think they are more prepared for the future. To have cost and resource efficacy. Right now, the simulation, to conduct a simulation, we need to have infrastructure, we need to have mannequins, we need to have a trainer, we need to have materials, equipments, and disposables. And if the skill is going to be incorporated in technology, I think all of the cost can be reduced to a greater extent. So now, introducing VR tech in nursing. So by integrating technology, nursing education can become more accessible, as we saw, more efficient, and it is going to be aligned with modern healthcare demands. Ultimately, it is going to produce competent, tech-efficient professionals ready for the future of patient care. Now, by incorporating VR into the nursing education, What are the key benefits? The first and foremost benefit is standardized learning. It is going to eliminate inconsistencies across institutions. Even within the institutions, there will be inconsistencies among the trainers. So if there is going to be a standardized learning practice, that is going to benefit students to a greater extent. The next one is immersive environment. For example, if you're going to learn BLS with the mannequin, we simulate and we read out the scenario. But with VR so it's going to be an immersive environment where the patient is going to really collapse and the student will sense the emotions, the expressions, the collapsed environment, understand it, and then react to it, or how to react to it, what to do, when to do. All that will be there in the virtual environment, which is going to enhance the student's skill. The next thing is risk-free environment. Students can practice without fear. Teacher is not going to stand around, number one. Number two, it is not going to cause risk to the patient, or it is not going to cause risk to the virtual patient or to the virtual environment. They can practice a number of times using one technology. Exposure to rare case scenarios. Now, when the students are posted in the clinical area, I might get exposed to diabetic ketoacidosis in critical area, and the next student who's coming into the critical area would get exposed to dengue fever. There's a huge difference in these two disease conditions, and what if the students are not getting the opportunity to know about rare scenarios? That is going to put them back. So with technology, we can bring in all the complex scenarios with which they can get exposed and be prepared to face the real life scenario. Language and cultural adaptation. Now, through virtual reality, we can learn the skills or the scenarios in English as well as in their local language, which is going to enable them to understand the skills better and feel comfortable of learning. Evidence-based practice. Have you done any evidence? And nursing is always there to follow the evidence-based practice. And based on that, MediSim VR organization conducted a research on the impact of virtual reality training on nursing students' proficiency in capillary blood glucose monitoring. And it is an explorative study. So far, no one has done any research on the use of virtual reality for nursing students. There were a number of studies conducted for medical students, but there were no studies conducted for nursing students specifically in India. So when this study was conducted, there were positive results from the students. So these are the metrics that were being evaluated through the study: knowledge, satisfaction, self-confidence, usability of VR, participants rated, participants perception of using VR. So in knowledge, there was a significant improvement post-training. The scores are laid down there, which states that the effect is more when they learned the skill using VR technology. Their satisfaction was higher, their confidence levels were higher, and it was easy for them to use VR, and it's not a hard thing for them to think that it is a tech and it is little away from them, but it was easy for them to use. And they also said that uh, confidence in application, simulation of the realistic scenario, educational benefit, all that were to a higher extent and to a greater extent. And to understand the study, it states that VR technology is very much useful and it is a viable option which can be incorporated into nursing education. And the nurses would get benefited out of this technology to a greater extent. Okay, now what are the products that are available in MediSim VR? So right now we have skill training and we have dashboard. So under skill training, we have multiple skills that they can practice in the VR environment. We have guided mode and we have evaluation mode. So the guided mode will guide the students stepwise from the beginning till the end, to say from the assessment till the completion of the procedure where they document it. So it is going to guide the student by saying, now you assess, next talk to the patient on this. And stepwise. It is going to take the students through the procedure, and the student cannot skip any step in between. They have to perform the procedure, which is going to force them to learn by themselves, and it is going to be a learning with fun. So that's how the guided mode is going to be. And evaluation mode will allow the student to be in the virtual environment, and the student will have to decide what to do from the beginning till the end. And post the evaluation mode, there's going to be a performance matrix, which is going to tell them which aspects they did well and the aspects they have to improve and the aspects they forgot to do. And there will be a score which is going to tell them where they stand while performing the procedure. The next product that is available with MediSim VR is dashboard. And whatever skill and whatever product that they're going to use through MediSim VR, the data is going to be captured in the dashboard for the students as well as for the faculty. For the students, it's about their performance and it's about their achievement. And for the faculty, it's about the entire batch's performance and how well they can think of improving the students' performance in the future. So that's how the dashboard is going to function. The next product that we have is virtual patients. That's our pipeline product. Virtual patients, it is a product where the student is allowed to enter into the virtual environment like how they are going to walk in the hospital. And when they go to the ward, they are assigned a patient. And even in the virtual environment, the student is assigned a patient. And after their assignment, they have to start collecting history. And the virtual environment allows the students to collect history and assess, understand what the patient requires. And based on that, the nurse will have to develop a care plan for that patient and make sure that the care plan is planned, implemented, and evaluated, re-evaluated, and understand how the patient is able to benefit out of the care that the nurse was able to perform in the virtual environment. So that's our future product, and that is lined up for the next year. So that's about technology and technology in nursing and how technology is going to transform nursing. And if you have to know more about it, kindly connect with us. We invite you to schedule a demo or discuss with your specific needs, explore the possibilities of nursing, transforming nursing education in India with MediSim VR. And there are two email IDs which are mentioned there in the slides. You can take a note of that and connect with us so that all of us together we can transform nursing education using technology. Thank you. Over to Dilip. Dilip?
Yes. Thank you so much, Jagdishwari. That was very insightful. I was just listening to what you were saying and the information you were providing. There is something which we lack, sharing of information, as you were correctly saying. And the research that you showed, the presentation of the information that how influential and how well the technology is being used to train the students and how it's being receptive and making the students more efficient in understanding things and getting geared up, to be future healthcare providers. That was really, really insightful information from your end. Thank you so much for your time and valuable information you put together. I know it must have taken you quite a bit of time, and we hope we'll be having further sessions in understanding how to improve, the skills and also provide better skill training to people who are looking to further their cause in making India better. Thank you so much.
Welcome, Dilip. Welcome the
Thanks,
institution
participants.
to
Thank you, everyone. Thank you.